All right, good afternoon. If folks could please take their seats. We're going to get started. So again, good afternoon. I'm Ann Person. I'm Director of Mathematica's Center for Improving Research Evidence, or CIRE. And I want to welcome everyone attending our forum in our DC office today. I'd also like to welcome those of you attending via webinar. CIRE's threefold mission helps to bridge the gap between policy research and policy practice by offering a broad range of expertise in designing and using an array of high-quality research and evaluation methods in diverse settings. We're pleased to co-host this event today with the Bill and Melinda Gates Foundation, which is committed to improving early learning for all children, including by supporting the understanding and implementation of high-quality pre-K programs. Please note that we're video recording today's session, and we might capture some of your images on the video. This video will be posted to our website within about a week. And so to help ensure the highest possible sound quality for our webinar audience, I'd ask that all of you in the room please silence your electronic devices. At the conclusion of today's presentation, we'll entertain questions both from our in-house audience and from our webinar audience. And now it's my pleasure to present my colleague, Dr. Luisa Tarullo, the Director of Human Services Research in Mathematica's DC office, who'll set the stage for our panel and introduce the speakers. Luisa?
Thanks so much, Ann, and a good afternoon to all of you, and welcome again to the forum. Early care and education, and pre-K in particular, are at an exciting moment, I think we can all agree, with federal, state, and local governments focused on increasing quality and access for children ages 3 to 5. So our topic today is the role of evidence in supporting the elements of quality and system building for pre-K. How can we provide high-quality services to as many children as possible and close achievement gaps in school readiness? And which elements of quality pre-K are necessary to provide that quality and close the gaps? So there's no shortage of guidance at the federal level. Recently, using research evidence and consensus from practice, both Head Start and the Child Care Development Fund have published new quality guidance and regulations, and these serve to guide state quality rating and improvement systems. And the Every Student Succeeds Act, or ESSA, includes the continuation of the preschool development grants, which are now jointly administered by Departments of Health and Human Services and Education. So from the research side, we know that the findings are somewhat mixed on preschool interventions. Some are showing promising impacts, others modest or no impacts. So we need to better understand what are the key factors that drive these differences. Might it be the cost per child served, or the use of an evidence-based curriculum, teacher mentoring, or other factors? And often these research designs do not allow us to unbundle these different quality features and determine which ones are primarily driving those impacts. So given the lack of this clear-cut evidence, what should the federal programs, states, and local education agencies do? Because decision makers in early childhood have to select curricula, hire and support staff, and assess children in their children's progress in their programs, but often they really lack the evidence-based guidance to make those good choices. So some of them, as we'll hear today, are turning to collaborative innovation learning teams that are meeting those needs and helping to build that evidence base. We'd love to talk about that more today. So we're going to have a really great panel, and we'll be starting out with Jennifer Brooks. And Jen is a Senior Program Officer on the Bill and Melinda Gates Foundation's Early Learning Strategy. And Jen will be describing for us what the Foundation has identified as the essential elements of high-quality pre-K in the context of the broader evidence base in early childhood. And then we'll turn to my colleague, Kim Bowler, Kim's a Mathematica Senior Fellow, and she'll be describing some of her work with the Early Learning Lab in Oakland, California. This lab is bringing together school district leaders, early childhood practitioners, researchers, and funders to identify and implement evidence-based pre-K solutions for improving early childhood outcomes. And next, we're thrilled to have two discussants today. Shannon Rudisil is the Associate Deputy Assistant Secretary for Early Childhood Development at the Administration for Children and Families. And next we have Delegate Ann Kaiser, who serves as the Majority Leader in the Maryland House of Delegates. And our discussants today will reflect on the role of evidence in decision-making at both the federal and state levels, and talk about how evidence is generated and used in policy and practice. We're thrilled to have them. So we know that we have many wise thinkers in the audience, and we also want to leave time for discussion, both here in the room and also through the webinar questions that you can submit to us. So now I'd like to welcome Jen Brooks to the podium to introduce the Gates Foundation's work in the area of pre-K. Jen?
Thank you. We still at morning? No. Good afternoon, everybody. Hi, as Louisa said, I'm a Senior Program Officer at the Bill Melinda Gates Foundation, and we are embarking on a relatively new strategy, national strategy on early learning. So I'm going to talk to you a little bit, actually, about how we came to focus on what we're focusing on in this strategy and talk a little bit about what that focus is, and with a real emphasis on the research basis and how that drove us to where we are. So first, just a little bit of historical perspective on the research. Actually, I'm not going to show that. It'll distract you. So we do have decades, obviously, of research on early learning and on preschool programs, and it goes back for a long time. And sometimes if you're in the national discussion about pre-K, you think we sort of have it all solved, right? Like this is a slam dunk. We've got the Abecedarian studies, the peri-preschool studies, all showing pretty impressive effects on kids and effects that went on into adulthood, even sometimes when you saw a little bit of diminishing, shall we say, in years that followed after the preschool program then. We've also had more recent studies on public pre-K in particular, as well as the findings from the big national Head Start Impact Study. And so those are in a more relevant context. They're more close to today's historical period. The counterfactual of kids being in other care, parents being at work is more relevant today. And they have been a bit of a mixed bag, right? So some states have shown really pretty impressive effects of pre-K on kids in the immediate aftermath. There's been less on longitudinal studies because of the design of those. Many of those studies are what we call regression discontinuity design, and they're a beautiful and sort of cost-saving way to look at the effects of pre-K, but the problem is you can't really follow kids longitudinally. And we've seen a lot of variability there, right? So some states look really good, others less good. So what does that tell us about how to understand what it is that drives outcomes for kids in pre-K? And then what do we do with this issue of, as it's gently regarded as fade out, right? We've just had an RCT from Vanderbilt come out that showed impacts on kids in the immediate right after their time in the pre-K program, and then some fade out and some findings that potentially went in the other direction, which are completely counterintuitive. And so I think as a field, we're really struggling with this. Okay, we have a sense that this as an age period, early learning, early childhood broadly, but also the pre-K period are really important for children's development. It can be really meaningful for long-term effects, but we don't know a lot about what do we do to really make it have the biggest impact possible. We've got something like 41 states now have public pre-K programs, but my sense is that their per child costs range from something like $3,000 to much, much higher. And so there's a lot of variability in what there is out there. So I'm going to talk to you about how we're trying to grapple with this, because we want to say, okay, at Gates, we care about pre-K, but not for the sake of pre-K. We care about it in terms of how is it going to drive outcomes on the longer term. And for us, the specific set of outcomes we're actually interested in are third grade outcomes on reading and math, which isn't everybody's outcome, right? I mean, I think one of the things we struggle with in the early learning field is getting much more specific about what goal we're trying to achieve and which programs are most important for those goals. For us, it really was third grade reading and math. That's where we focus. That's what we're emphasizing. So what can we say about what the research says about our best chances of getting to third grade reading and math? A quick aside before I tell you how we sort of decided to focus on that is just the point that we were having this conversation before we started about the tension between asking what we can do in 1 year of children's lives to make a benefit that will last for their entire lives. And, you know, if you take an education perspective, we rarely pull out third grade and say, what's the impact of third grade longitudinally? Does it drive outcomes for kids? Are they getting better jobs because of their third grade teacher? And so there is a little bit of what's the right question here that we really should be asking ourselves. Having said that, our focus is third grade reading and math, so that's what we paid attention to. So for us, our theory of change is that if we can get more children into high quality pre-K, that will lead to better quality care, good, strong teachers, an enriching environment that will then affect both where kids are at and they enter kindergarten and in the long term improve third grade outcomes. But in order to do that, we had to say, well, what is high quality care? And this is something I sat at ACF for a while, for 9 years, before I came out to the real world, I guess I'd say. And, you know, we spent some time with the Head Start program saying, okay, we're getting this message from Congress that we need a set of regulations that are based on the evidence, which sounds so easy. But then when you start to peer at the evidence, it's really complicated. There is no straightforward answer about what is effective when it comes to curriculum, when it comes to PD, when it comes to teacher pay, when it comes to teacher degrees. These evidence bases are pretty complicated, and then when you think about all of these things intersecting with one another in a classroom, it gets even more complicated. So what we did was say, we had a consultant who said, you know, let's look at the pre-K programs that have had the biggest effects on kids and have some evidence of longer term effects on kids through third grade. And so that was a consultant named Jim Minervino, and what he did is he looked at the programs in Maryland, in New Jersey, in North Carolina, and in Boston, and said, what are the common elements here? We can't get a slam dunk answer on this matters and that matters, but can we say what's common about these things that seem to drive longer term effects? And so this is actually what we pulled out. 3 main categories of issues. And one thing I will say is much of the research on pre-K and early childhood generally is at a classroom and practice level. What has to happen in that classroom that is most proximal to the child. We are asking at a systems level, and by system, which the system I mean is policy systems, right? So what does the policy structure need to look like in order to support effective practice that then produces benefits for children? So we found 3 big categories. One is an enabling environment, which is sort of the public and political will, the leadership in the agency, which we often ignore, right? Who is sitting in that early learning agency or that Department of Ed or Department of Health and Human Services, monitoring this program and making sure it's being implemented well. Also program policies, so these are the things we've all focused on for a long time. Is there sort of a supportive environment for effective practice? Are the class sizes reasonable? Are the teachers degreed? Are they credentialed? We put a lot of emphasis actually on the pay of the teachers. Are they at pay parity with the K-12 system? Otherwise we train them up and they move out. Full day, is there learning standards in place? Is there language about curriculum that puts an emphasis on effective curricula that have some evidence? And also supports for key populations like dual language learners and children with special needs. And then you have the program practices that we all focus on. So how is that curriculum implemented? What is the child assessment process look like? Does it feed back into what teachers are doing with children? What sort of PD are teachers getting to support all of this? And is that system integrated? We talk about curricula as if they're sort of these things that stand on a shelf, and PD as something completely different. And really these things all need to be tightly coordinated. And I think that's one of the big takeaways from the research in this field. is there a data-driven decision-making process at every level of the system, in the classroom with individual children, to assess what's going on in the classroom writ large, at the program level, at the district level, at the state level? Are people using data to say, how does this look? Is it looking like it's high quality? What do we need to tweak if it's not? And then evidence that actually the teacher-child interactions are focused on learning and high quality. That is not focused on learning to the exclusion of relationships. It's in addition to the quality of the teacher-child relationship. So it's both, are they in a supportive, healthy relationship with their teacher? Is it a positive environment? And is it focused on learning? We are agnostic on a lot of things that are big debates in the field. So we're agnostic on the auspice. Many states have made this work by offering grants to community-based providers and schools and Head Start. We're agnostic. Whatever a state wants to do in that space, we're fine. Some of these essential elements are going to be harder to achieve in different environments, and that's one thing we're really struggling with. So in a world where states want to include community-based childcare, which seems like the only way we're going to get to scale, how do we think about pay parity? How do we think about degrees without driving the diversity of the field down? So some of these really tough we want to move toward quality, but we want to keep some really important elements of this system in place. That's the kind of stuff we're working on. We are agnostic about universal and targeted. So from a research perspective, I think the best evidence we have suggests targeted is your most effective, that the benefits accrue mostly to the children who are lower income and more at risk in the program. Having said that, from a political perspective, there's a whole other set of issues to think about when you're thinking about universal versus targeted. So if the end goal is to get outcomes for those low-income children and a universal program is the only way you're going to do it, go for it. So, I think sometimes it's about weighing that empirical evidence against our values and the political realities of these systems. And then whether 3s and 4s is also something that we're kind of leaving up to the states. So what we're doing is finding a select group of states who already have pre-K in place. They've already made a commitment to their kids and their families to try to do this and do this well, and helping them get to what we consider the 15 essential elements of quality. So where they're missing, really pulling that together. Right now, our primary focus is on Tennessee and Oregon. We are also doing a little work with Arkansas. And these are states that have really tried to make a huge commitment. From a research perspective, I think Tennessee is just amazing, right? Here's a state where you have a RCT that shows less than wonderful results that could have just resulted in an entire backlash against the system. And as a state, they decided to come together and try to focus on quality. So the state legislature has passed legislation around building quality in that program. So those of us who really care about getting this right need to help them make sure they can get that right. I think it's a huge statement about the use of data for improvement. These are our essential elements, are sort of our best guesses, right? I mean, this is the best we could do based on what we have so far. And so this is really hypothesis testing as much as it is proving that this is the reality. If we can do this without some of these elements, that's great. If we can do this without full penetration of some of the elements, that's also good to know. So does every single teacher need to be BA credentialed and at pay parity? Does every single child need to be at full day? Those are the kinds of questions we're going to be asking in our initiative and trying to get the answers over the next couple years. So with that, I think I'm out of time. I'm going to hand it over to Kim.
Thanks so much, Jen. So when we consider the sources of information for evidence-based pre-K programs, practices, and policies, the U.S. Department of Education's What Works Clearinghouse is a primary resource for state and local decision makers. The WWC provides systematic reviews of published literature and research studies to determine whether the science meets specific evidence criteria. Was the research done well? And if so, it then moves on to determine what impacts or effects the interventions had on certain academic outcomes. Full disclosure here, Mathematica is the prime contractor for the WWC. As far as pre-K programs go, Of the 77 total the WWC has looked at in pre-K, 25 have studies that have met the evidence standards, meaning the studies are done well in that category. Of those, 16 pre-K interventions were found to have positive impacts, solidly positive, not mixed, on their targeted outcomes. Let me say that again. 77 reviewed, many curricula, practices, and programs that are used widely in our field. 25 met standards, 16 had positive impacts. There are a number of reasons why this may be so. Issues with the studies themselves, of course. Those of us who are evaluators know there are many ways that a rigorous study can go wrong. A rigorous study was never mounted to begin with. Implementation was poor. The practices were poorly taken up by teachers, for example. The premise of the intervention was poor, or the intervention was too weak. It probably should have been scrapped or majorly enhanced or improved, perhaps. Or there were no interventions at all to address a specific area of pre-K program problems or needs. So what should happen in the absence of, if there isn't an intervention, that rises to the top to meet the needs, local needs? And how do we get more into the pipeline? How do we get things that are actually responsive to local needs, that fit into the budgets and into the professional training specifications that are available for teachers and for school districts and for programs? One alternative is evidence-based and evidence-informed innovation and improvement. These methods draw on collaboratives that exist and have been honed over time by organizations such as the Institute for Healthcare Improvement, or IHI, and they also draw from the work of the National Implementation Research Network, or NERN's Active Implementation Framework. Let me switch hats here for a moment and turn to the work that we're doing in California. This is a project I'm part of that's led by Executive Director of the Early Learning Lab, Catherine Atkin, and the lab's Director of Workforce and Professional Development, Christine Sciorino, who's leading the district-led level work I'm going to present today on behalf of our larger enterprise. So the Early Learning Lab is about 2 years old. It's designed to spur on innovation in early childhood in both the formal and informal, meaning classroom-based, home-based, and parenting areas, in support of our young children's development in California and nationally. We're using approaches from business and manufacturing, drawn from Deming and Silicon Valley, behavioral health and healthcare, and methods such as rapid cycle evaluation to speed up the process of innovation. We're focused on bringing new solutions to early childhood that are potentially more relevant and more responsive to the immediate needs and circumstances of users that hopefully will have larger impacts on than our existing interventions. We work collaboratively with a range of program representatives, staff, participants, and expert developers of interventions in implementation teams to put new and improved interventions into the pre-K pipeline. Guided by the vision of Miramani, Jeff Sunshine, and the whole Children, Families, and Communities team at the David and Lucille Packard Foundation, Starting Smart and Strong is the Foundation's 10-year, multifaceted investment in school readiness in 3 California communities, Fresno, Oakland, and Santa Clara. As part of that investment, each grantee was asked to use a portion of its budget to participate with the Early Learning Lab in innovation projects. At the same time, Packard funded the lab to co-design what we call the district-led innovation and improvement work. We call it that because unlike other collaborative innovation projects, we're not imposing the focus of the innovation or the intervention, what it should be. We're not coming from the outside and saying focus on this content area or use my specific curriculum. We're asking them to identify a problem that's rooted in data that they want to work on in the preschool area, a thorny outcome that hasn't moved. Then we help them identify a solution. If there's one that's off the shelf, has an evidence-based intervention from the WWC or another source, great. Our role is to help them adapt it to their setting and to their systems. If not, we help them launch an innovation project that will ultimately be scalable and enter into the manualization and evidence generation pipeline. The Fresno Language Project is one example. Partners there are the Packard grantee, the Fresno Unified School District, with team leader Deanna Matthews, and Packard's technical assistance provider, Whit Hayslip. The district is diverse, with a large proportion of children speaking languages other than English at home. The team identified fourth grade English language proficiency and home language development as the topic that they wanted to address. English language proficiency scores for their English language learners have been stuck at levels they're unhappy with for quite some time. They wanted to work at this at the pre-K level. Their project is actually focused on birth to 5 and includes multiple types of settings, including district, Head Start, Early Head Start, and family childcare, and the lab helped them look for solutions. There were none suitable in the WWC or other evidence reviews. In our first year, the lab worked with the core team to develop a logic model for the project, work on innovation development, including training and coaching for a small group of teachers, conduct a small-scale implementation supported by national experts Linda Espinosa and Elizabeth Magruder, and plan for using data to inform feedback loops and chart progress. This year, we're continuing the small-scale implementation, refining the model, documenting it, and launching the collaborative. The goal is both solidifying the lab's procedures and facilitation of the district-led approach, as well as actual classroom-based English learning with the home language support solution that can be shared with the district more broadly and begin its entry into the evidence generation pipeline. The ultimate goal is a robust intervention that's replicable and evaluable and can fill this gap in the field. This is a graphical depiction of the representation of the district-led collaborative we're implementing this year, and it will be familiar to those of you who have seen the Institute for Healthcare Innovation materials and those used by collaborative innovation and improvement networks, such as the one being implemented in the maternal, infant, and early childhood home visiting program. The idea in the top box is that the implementation team, composed of local program practitioners, including district leads and representatives of the local implementing sites, plus the lab team, plan and support local sites. Classrooms get trained in the solution, focus on data to determine which change is happening as planned, and participate in data-driven discussions to help plan for ongoing tweaking of what they're doing on a daily basis. They plan activities on what they learn about the classroom supports for English learning and home language development, do them, study progress on teacher implementation and targeted child and parenting changes, act on the data they see every day and week, and in the project cycles. The larger learning and scaling collaborative in the bottom includes the implementation team, program evaluators, the district and community leaders who come together a few times a year to look at the progress and share solutions and the learning. The problem solving and data review feeds back into the project cycles and learning processes and further improves the intervention and planning. So what we're seeing here is a lot of excitement and motivation and engagement of teachers and partners. Teachers are saying that this is the first time they've ever been asked what they think might work in their classrooms. They're being taken seriously by administrators and by the quote-unquote experts. They're coming in on Saturdays for these workshops on how to do English language learning strategies. And although hesitantly at first, and sometimes with a little bit of moaning, their enthusiasm is really palpable. And the learning and sharing bubbles throughout these trainings and throughout the work that they're doing in their classrooms. This feels different because of the co-design, like it might really have a better fit and be taken up and sustained by the teachers. Our coach is optimistic, and some of our measures are focused on collecting this as a qualitative feedback for us. It takes the best of what the evidence is saying about how to build networks for engagement and learning from Tony Bright and from others. There's a big emphasis on data without trying to overwhelm the teachers. Our mantra really is less is more. We're not trying to do evaluation here right now. The evaluations are to come. We're solution making and prototyping, a different role for a researcher that I've really had to put a different hat on for. This kind of work is designed to enrich and build the evidence pipeline. New solutions will get there eventually. Again, this approach is a variation on a number that exist, and we've learned and we've built on them and appreciate standing on the shoulders of the people who have gone before. The lab has brought many of these individuals and collaboratives together to talk about how to do this work and do it better to propel innovation and improvement itself forward faster. Thank you very much, and let me turn this over to Shannon, our first discussant, Shannon is in a unique position at ACF because so much is happening there, as Louisa said, that relates to pre-K. She has a long history as a constant consumer of evidence to guide policy and practice. And Shannon, thank you so much for being with us today.
Thanks, it's my pleasure. So we were asked to discuss a little bit about what was presented and also talk about what we're doing. I'll just say I found it really heartening to hear where the Gates Foundation landed in terms of their essentials after your study, because I would say that very much mirrors what we're working on in Head Start, and some of those same elements are things that we're working on. So I can talk more about that in a minute. And also is very heartened, Kim, to see your Plan, Do, Study, Act cycle. We recently took the Head Start and Child Care technical assistance projects that we've had and put them together into one technical assistance system. And one of the things that we've started to do is when we're going to put a resource on the web, we have a website called Early Educator Central, for example, where we tried to take all of the public domain, federally funded training and put it in one place so people wouldn't go out and use their state and local dollars to procure the same training over and over again. But one of the things that we did was we asked people to slot, like, where on that cycle they are and where a given training fits in. So it seems like there is some convergence. As much as we started out with, there's so much we don't know, there is, I think, some convergence going on, which is heartening. So when the Obama administration got in place in 2009, I thought it was noteworthy that one of the first steps that we took at that time was the formation of cross-department study groups across the Department of Ed and HHS on a number of topics. And my colleagues from the Department of Education, Libby Doggett and Stephen Hicks, are here. And Stephen was here at that point in time and will remember. So we had study groups on given topics, which I don't know that there was any precedent for this. This was our leaders at the time, Joan Lombardi and Jacqueline Jones. This was their endeavor. And so people had to come together. We had about 6. They ranged from everything from curriculum and assessment to family engagement. And we had both research staff from the 2 departments, Jennifer might have been on some, and program staff from the 2 departments. And people really had to sit and come up with what were the best ideas that we had and give presentations to each other. And it was as much the act of doing it, I think, as the knowledge formation for the departments that came out of it. Recent changes that we've made in both Head Start and Child Care have been informed by that kind of evidence. We, of course, are working with the Department of Ed on the preschool development grants. That's a little earlier in its life cycle than Head Start and Child Care. But I think if you look at the preambles to the 2 regulations that we recently published, the Head Start Program Performance Standards and the Child Care and Development Fund rules, when people say, okay, where can I go find the research evidence on a given topic? I'm like, you should go to the preamble of that regulation, because we worked really tightly with our research offices to form the policy development. And for those of you who maybe don't read federal regs a lot, the preamble is the part where, you know, the poetry comes in, and you can really say, like, this is the rationale for why we're doing X or Y. And the regulation is really the law, what people are going to have to implement. But if you read the sometimes hundreds of pages of those preambles, that really explains our thinking, where we sat down and we sat with researchers and we sat with practitioners, maybe listening sessions, which is something that Ed has also done a lot with us. And I think if you read them, you'll find they're excellent research syntheses on a lot of the big issues that were facing us in the field. Some of the examples, within Head Start, over a number of years, we've had an intensive focus on interactions, on teacher-child interactions. I think that was an area where we really followed the evidence to show that teacher-child interactions are among the most predictive factors. You'll see more recently, we've been working hard on extending the length of the Head Start Day and the Head Start year. That was another point of convergence with what Jennifer presented from the Gates Foundation. We have still a fair number of very short programs, both in terms of number of hours of day and number of weeks of year. And we felt like what we were learning about dosage, as the researchers say, were showing us that we'd have better impacts with longer. So we actually devoted some recent money for grantees to lengthen the day and the year. Another place that I have a lot of examples, but I want to give a child care example. We looked very hard at research on the importance of stability and continuity for children in relationship building. And in the child care program, which is eligibility is usually linked to parents' work and low-income parents' work can be very unstable and changing a lot. Kids were coming on and off their child care financial assistance, sometimes after 3 or 4 months, and then having to leave their setting. So first of all, it's a struggle with very little money to get kids in a high-quality setting. But when we got them in, we couldn't even keep them there because of the amount of churning. And so we worked for pretty much all of the past 7 years to make the point, working with Deb Phillips and others at Georgetown around stability for children, to make the case that kids needed longer, like they have in Head Start. And Congress, when they passed the reauthorization for the child care in November 2014, included that there should be a 12 months minimum. And I think kids need longer, but that's a huge leap from where we were, which was 3 to 6 months. And I think that's a place where an understanding of child development, really we followed it through to something that seemed like sort of an abstract notion of how long somebody should get a voucher in a big eligibility system at a state level. But we really took it back to child development and were able to make the case. You know, the other thing that I would say that we've been successful is I think we need a combination of research and data. We underutilize our administrative data sometimes that we have from our programs, and frequently both are necessary. You know, one thing that I'll say, the first thing that we thought about in terms of starting with data is where kids are. And that's really what led us at ACF to think across Head Start, childcare, and pre-K, because the fact is we still have like, you know, fewer than half of all eligible, and eligibility being poverty. So that's not even a particularly generous eligibility standard. Fewer than half of those kids are able to access Head Start, and a lot of the rest of them are in childcare, right, where there's not a community-based pre-K. So that really led us to look at, we've got to raise things all across the board. And the other thing that I would say is we looked at the fact that kids are born learning. And that's the number one thing I think that we've learned from research. And we've really tried to ramp up birth to 3. We think waiting to 4 is too late. One of my colleagues came to, was working with us for a while, and she said to me in the hallway one day, since I started this job, I've been to so many presentations, and she meant inside and outside of our agency, where the whole beginning of the presentation is about brain development, birth to 3, and the whole policy implications section is about what we do at 4. And that was true, right? And so we've been really focused on early Head Start expansion, early Head Start childcare partnerships, and how we get more services in that birth to 3 space. So Anne, be interested in hearing how the state perspective.
Thank you, Shannon. Good afternoon, everyone. My perspective to provide today is kind of on the ground how things are working in the states. So I'll talk about where we are in Maryland, some of the policies we've had over the years, and touch on, of course, some research-based evidence and tell you a little what we've been doing in Maryland. So first, back in 2002, our state made a huge investment in education and a big study at that time to look at adequacy. What does it really take to ensure that everyone has an adequate education? And that meant a large state infusement of dollars over the years. And the state's role is well larger than it's been before. But part of what came out of that was that low-income kids, it was mandated that they would have a half-day pre-K. So that was the beginning of things back in 2002, 2003. Over the years that I've been in the legislature, and I joined 1 year after that big legislation happened, there's briefings just about every year telling people about the value of early childhood education. And what's nice for me to see is my colleagues over time finally believe it, because people don't have that background. I got my master's in education and did my thesis on Head Start. So I was coming already from that place, and although everyone else here is the researcher, practitioner, and on the policy side, you know, we touch the policies now and again, and then the implementation happens afterwards. But still to see my colleagues finally understanding that that payoff existed. And at the same time, Maryland has done a lot to enhance kindergarten readiness. Through our kindergarten readiness assessment, I think jumping about 20 percentage points over the years. Still some of those gaps that we're all concerned about, but certainly at the same time, enhancing everyone's kindergarten readiness. In 2014, we passed new legislation regarding early childhood education, and it was an infusement of just $4.3 million. And it was just a step to say, let's enhance the eligibility of who can be in these programs. This initiative was spearheaded at the time by our lieutenant governor. Our lieutenant governor was running for governor he lost. But the expectation had been if he won, that was just the first step, that we would keep adding. The other challenge we have is when people say, you know what, I get it. That investment today will give us that payoff in a few years with high school graduation rates, with all the adult success levels that we know. And yet people say, even though we know it's worthwhile, we can't afford it today. And that's always disappointing. The other challenge we had is the people who said at the time, why are we only enhancing this by 4.3 million? Why don't we go universal right away? And well, that sounds good. I was shocked every time I heard it, because I would say to those colleagues, well, we don't have the space available in our schools. We don't have the number of teachers we need. We don't have the training involved. There's all these pieces. And they said, well, who cares? All these kids need it. Well, that's true, but the political reality is you can't just create that workforce overnight. What we've done with some evidence-based research, when I mentioned that we did this big study back in 2002 to look at state funding, we've begun that process again. And I'm part of that study to look at adequacy again. What are the funding requirements, or what do we need to do? So part of our bill this past legislative session asked our consultants to look at a cost-benefit analysis of pre-K education. You know, some key points: should it be expanding it for more 4-year-olds? Should it be creating the opportunity for more 3-year-olds? Should we be looking at low-income students versus all students? So essentially using that research to help us prioritize where our funds should go. This bill, adequacy again, that it's called, also included a provision. It was just kind of thrown in at the end, a provision to look at how ESSA would affect education in our state. So there is a work group looking at that, and a stakeholders group that's still doing their work in that area. So just kind of oddly got thrown in with the legislation, but fortunately is happening. Our consultants have come back saying that it should be universal, not mandatory. It should be for 4-year-olds. It should be all day, but they didn't really come out with an answer to fund it. I'd like to wrap up with one point. When people say, what do legislators need when it comes to data and analysis to make decisions? If you haven't heard it before, make it short, keep it simple, don't assume that people have that background. And I would say that the best advocacy group that ever came to us, every week they'd send one piece of paper. On the front side was the data and facts. On the back side was the story of one person who was helped by the program. And I think if you want a legislator to read something, that's the way to go. Thank you.
So thanks to our great panel, and we definitely want to hear more from them, but we would like to have you help us guide that further discussion with your questions. Here in the room, we have a microphone, so if you have a question for our panel, just raise your hand. We'd love it if you would identify yourself and where you're from when you ask your question. Right up front.
Libby Doggett at the Department of Ed. Thank you all. Thank you for doing this. What incredible research, and we really appreciate being included. The one thing you didn't talk about that we're really interested in is more integrated, economically integrated settings. And I don't think we're doing enough research in that area. We all learn because these smart people are here. I think kids learn a lot when they're smart kids in the room. I think smart kids learn a lot when they're kids who are very street savvy in the room, and there's a lot of mixture. I think children learn a lot from each other, and that's kind of been ignored in the research. So I'd love to hear your thoughts about that.
So I mean, I can speak to that, but I think mostly what I would say is I agree. I mean, I think we do have evidence in K-12 that this is important. We have quite a lot of evidence, actually, that kids do better, certainly in later years when they are with kids who are at sort of a level higher than them. Not to suggest that income is equated with skill, but I do think the exposure. And, you know, it's a pluralistic society. I think children being exposed to diverse environments is important as well. And when we segregate it by income, we segregate by a lot of things. So we don't have the evidence base, but this is another place where both evidence and values matter. And I think it's something we need to pay way more attention to.
So for the Office of Planning, Research, and Evaluation, we have a project going on right now called the Cost of Early Childhood Quality. Evelise Martinez-Beck is our project officer, and Gretchen Kirby is our project director. And I have to tell you, this is to develop the tools to understand what the costs actually are, Libby. And it is very complicated. This blended, braided, as you know, and just trying to parse out, again, using the categories of implementation science, the workforce investments, the leadership, and going in and asking people to show us their books and show us what are those costs, and much less getting to the point of saying, you know, the trade-offs of those investments and what are the effects on children. So I think people more and more now, and I'm always there, I'm like, what does that cost? What does that cost? What does that cost? People are investing in trying to understand the costs and the models for a large agency. I mean, we've had people say, you know, it's almost impossible to run a center for less than 100 children, for example, right? Like, what's the scale that will, you know, allow a business, allow a place to run? Much less, again, sort of the costs, you know, getting costs out of a district. Like, how much does it really cost to do this in a district setting and in a small childcare setting, community childcare setting, and much less putting them all together. So I think those are fabulous questions, but it's been very hard to get there. I mean, in the context of an impact study, to do the cost benefits, you know, really needs to be done, but I don't know that we have even the measurement tools to answer a lot of these questions.
I mean, it's interesting. So, I live in Arlington County, and I think there's sort of the state pre-K dollars, and then there's Arlington's pre-K dollars, and it's on a sliding scale. And so they, have slots in certain schools, and there's huge demand for that pre-K from, it's free for low-income families, and then from the higher-income families, there's a huge demand. And those are probably opportunities to start studying what does that mean, and also what does it mean for scaling when you can figure out a way to leverage private dollars as well, like what families are willing to pay. And it's definitely something we have not paid enough attention to.
Thank you. Other questions here in the room? Steve, do we have anything online?
Here's a question from George Coleman, who asks, does access to peers that have social and cognitive advantages impact the discussion of all versus targeted?
I mean, I think this is very related to what we were just talking about. It does, I mean, at least from older grades, we do see that kids benefit when they're exposed to other children who are sort of a step up ahead of where they are in terms of their skill set. And so it is one of the arguments for universal, I think.
I would just add to that. I think that the other area that we know a little bit about that is the area of inclusion with kids with disabilities in classrooms. And, we have some evidence that benefits all of the kids. And I was just talking to my colleague Amanda Bryans at ACF, and she said there's even more evidence that she's seen emerging on that the inclusion of kids with disabilities benefits all the kids. I think part of it might be the culture, and this is just my own hypothesis. Perhaps we shouldn't just throw off hypotheses in a research setting, but the idea of individualization is so ingrained and embedded in the special ed world, and we're trying then now to bring that over for all kids. I think we're doing that across the whole education spectrum, not just in early childhood, trying to talk about using our assessments and individualizing. And that's a skill set that's pretty well in the culture of special ed. So it's not surprising at all to me that when you bring that together, you're going to see benefits for all the kids, because there's going to be more of a culture of individualizing for kids.
There's one other hypothesis, I think, related to the universal versus targeted question that I think has been totally unanswered, which is the degree to which in a universal program, and whether that's statewide universal or universal in a specific locale, affects this fade out issue that we're seeing, right? So the question of whether when kids go from pre-K to a school where there's a mix of children who have had pre-K and have not had pre-K, how much are we shifting what's going on in later years, or are kindergarten teachers largely targeting those children who haven't had exposure and bringing them up? In which case, exactly, in which case what we're seeing isn't surprising. And so I do think that's another question of, if this is sort of to help move the way schools work and only some kids have exposure to it, are we going to see the kind of benefits we think? And that has not been addressed either in the research.
Sort of a follow-on question to that. In the universal programs that exist, to what extent are they actually economically integrated? You know, our public schools tell a little bit of a different story there, so I'm curious.
Yeah.
It might have to be engineered almost.
Let's let Stephen get into the conversation.
Yes,
Thank you. I think, and that's a great question. Stephen Hicks, Office of Early Learning at the Department of Education. So I know, Jennifer, that Gates does a lot of work on this continuum of preschool through third grade, and you allude to a lot of it in how communities are measuring outcomes, looking at fourth grade outcomes, et cetera. But I didn't see in the model, as part of exemplars, this articulation, you know, with your curricula, with your teaching preparation, standards, et cetera. Could you talk a little bit about that?
So is that the degree, are you asking about the degree to which the pre-K
Yeah.
is sort of coordinated with the broader system, like the K to third work?
Yeah, and how that needs to be, that's a necessity.
Yeah, it's interesting. I mean, our focus really has been on what are the elements in the pre-K, but we, you know, in thinking about selecting states, this was a big part of the discussion. Albert's one of our grantees, and he remembers that as well, of, you know, do we really want to go into a system where the pre-K looks great and the K to third looks great, not so great? And the interesting thing to me, actually, in doing the pre-K work, and this probably isn't surprising to you at all, is that some of the states that have the best pre-K programs have the worst K to 12 systems, right? And you sort of wonder, is that because they thought this was going to fix it? Like you somehow can just do pre-K well and you don't have to worry about anything else. But it is something we haven't included in the definition of the 15 essential elements, but it is something we're paying attention to in the states where we're working. And frankly, it's actually, I mean, in Tennessee, that's a big part of the discussion, right? It's, you know, every time you have one of these impact findings that have fade out or sort of convergence, whatever you want to call it, that conversation comes up. Is it really that pre-K isn't working? Is it that K to third isn't working? Is it that they're not working together? So it isn't a core part of our work, but it's definitely something we're focused on. I think also talking to our partners in Gates who are working on the K-12 system and saying, okay, they historically have focused on the older grades. Can we start paying attention to what's going on? Because you can't just drop a kid into a bad, you know, kindergarten and expect that these benefits are going to last for a lifetime. So.
Any other questions in the room? Yes, just 1 minute.
Hi, I'm Victoria Jones from the National Head Start Association. And I was kind of wondering, in looking at these models, whether you, Jennifer, and we have ACF up here, so it'll be relevant, but whether you feel like health aspects fit into this model of exemplary pre-K, and whether we are thinking about kids' physical health, mental health, social emotional health, and how that plays into whether they'll really be able to learn and do well over time.
You want to take it first from an ACF perspective?
Yeah, well, I mean, obviously, I think that that's of huge interest to us at ACF, and one of the things we've been working on over the past few years is also building up tighter and tighter relationships with the colleagues at the Health Resources Services Administration and the Substance Abuse Mental Health Services Administration. We've launched co-projects on mental health consultation in early childhood, for example. You know, and the other thing that really struck me that I think, obviously at HHS, in the Head Start context, we believe comprehensive services are key for a long time. But I have, working with our colleagues at Department of Ed, noticed that there's increased awareness and interest on the, you know, among both. And I think part of it, honestly, is the attendance work. Mm-hmm. So we have the My Brother Keepers initiative. We have a chronic absenteeism initiative that everybody is government-wide, I think, not just HHS and Ed. And when you look at data about what affects attendance, I actually was really surprised when I looked at the attendance work data, because I believe that health is important, but I actually assumed it would be more about transportation, all these other things. Most of the top causes were about health. So, you know, I think that that really points to a place where we can all come together around that, and it'll fit very nicely, you know, cross-culturally into school district and education and early childhood worlds.
Yeah, from our perspective, I'd say, we were really letting the 4 places that we looked at guide us to call out the 15 essential elements, and health was not one where there was a consistent sort of focus from the state level. Family engagement, honestly, is actually another where it's not on our list. It's not because we don't think it's important. It's because there wasn't something consistent across the states on family engagement. Having said that, anybody who works in pre-K or has ever worked in pre-K knows that teachers' engagement at minimum with the parents is just utterly critical. So, I think on the health, having spent a lot of time working on Head Start, I think we as a field have to get a better understanding about which pieces of this are important, which pieces are done by the program themselves, and which are about coordination with other services in the system. I mean, I am a believer that you can't do all things well. And so I do think we have to figure out, I was just talking to somebody about this actually in relation to social emotional for the rest of the education field, where they almost strike me as just completely thrown off by this conversation, because they're hearing about grit, and they're hearing about toxic stress, and they're hearing about all these things, and they're trying to figure out, how does this fit in our frame of what a school does? And because the conversation hasn't been differentiated enough about, listen, in a school context, these are the things that you really could do no matter what, whether you have a health person on staff or not. If you have a health person on staff, then you can do this. And then there are these other things you can do by coordinating with the community. Instead, it's always sort of, let's throw it all into the conversation, and if you talk about one and not the other, you must not care about it. And, I just think there's a lot we can do to help people get a better handle on how to make this happen in any given field where they can only do so many things well.
One of the things on innovation and improvement related to things like attendance and engagement are these solution-making strategies. Like, you can come up with things based on existing evidence that aren't necessarily already all packaged together. You can put strategies together, whether they're texting or knocking on doors or some combination of home visits, that you can put together and have those potentially be a new kind of a strategy or a new intervention and solution that can be tested. So again, getting things into the pipeline that can solve particular problems, whether they're health problems, attendance problems, engagement problems.
I think we have another question from the web.
This one's from James Squires, and he asks, given the benefits of full inclusion, are there any lessons or suggestions for policy regarding flexible class sizes or teacher qualifications?
Anyone? Stumped our panel.
Wow. That's a really good question. Yeah, I will say that we think that class size is important. And when you look at the preschool development grants and things, it really came in. Libby and I always remember this. We were at an AYC conference, and we were presenting together, and we were talking about inclusion, and we were also talking about not suspending and expelling preschool students. And I really admired this person's bravery. A person stood up and said, I get it, I believe it, but there's 28 4-year-olds in my classroom, and I'm by myself, and so what you're saying is completely not workable for me. And, that really set us back a little and reminded us why those sort of preconditions of success that I think were at the top of that chart that Jen showed is important, right? Because I think that is tough. I'll say that one of the things we've been doing in our early Head Start childcare partnerships, where we're going out and putting early Head Start standards into community-based childcare, and part of that would be 10% of the kids would be identified with a disability, because that's an early Head Start standard. We feel like that's facilitated by the fact that you also have to meet the early Head Start ratios and group sizes of 1 to 4 teacher-child, and then no more than 8 in a classroom. So I feel like that, we're trying to work on that.
So I'm sorry we're going to have to leave it here. I think we should have had a longer webinar today, but I'll turn this back over to Ann Person to take us out.
Thank you to our panelists for your insights, and thank you to everyone who participated, both here in DC and via webinar. I hope you enjoyed the discussion. Please be sure to let us know what you thought of the forum today by completing the comment card, either in your packets here or electronic survey that'll be offered to webinar participants. Again, thank you everyone very much. All right. And thank you for advancing.
Good job, guys.